Chapter 8: Blood Collection Equipment for Venipuncture and Capillary Specimens. Upon completion of this chapter, you will be able to describe the latest phlebotomy, safety supplies, and equipment, and evaluate their effectiveness in blood collection. List the various types of anticoagulants and additives used in blood collections, their mechanisms of action on collecting blood, examples of tests performed on collected blood, and the vacuum collection tube color codes for those anticoagulants and additives. Identify the various supplies that should be carried on a specimen collection tray when collecting blood by venipuncture or skin puncture. Identify the types of safety equipment needed to collect blood by venipuncture and skin puncture. List substances that can interfere in clinical testing of blood analytes. Introduction to blood collection equipment. Collection equipment is used for venipuncture, which is blood collection from the vein. Skin puncture, blood collection from a finger and or an infant's heel. Then you have your arterial punctures. Venipuncture equipment includes vacuum tubes or evacuated tubes and safety needle collection devices, tourniquets, supplies to clean the puncture site, labeling supplies, gloves, special trays to transport blood specimens. Vacuum or evacuated tube system requires an evacuated tube, a double-pointed needle, and a special safety plastic holder adapter that covers the needle after blood collection. One end of the double-pointed needle enters the vein, the other end pierces the top of the tube and vacuum aspirates the blood. All right. Here are what your basic vacuum tubes look like. It's the what the setup looks like as it's being performed venipuncture. You see here that needle hasn't entered the arm yet. Um, in this picture, you see that the tube has already been placed in the hub. It's to each its own, whichever works best for you when it comes to collecting the blood. I myself, I prefer not to put the tube inside the hub prior to the inserting the needle, because what could happen is if I miss that vein even by a centimeter because the patient flinched, exhaled, whatever the case may be, now that top has the tube is vacuum sealed, and now that there's an opening in the tube, air is starting to seep out. You have to fill each tube each tube is required to have a certain amount of blood in it. Okay? So once that air starts seeping out and starts filling up with space, the less blood that will go in there. So that's why I'm personally not a fan of going ahead and attaching the tube into the holder, the hub. But whatever works best for you. If you starting out, I believe this is a good technique, because if your hands aren't sturdy, you definitely don't want to be standing there moving that needle around in the person's arm, shaking, fumbling, trying to pick up a tube, which is fine if you're going to do that. Even with that, I would still recommend to just hold it in there. Work on holding it in there, and then once the blood is in, once you see that, once you see that drawback in the needle, and even on you, it's easier to see on a butterfly, but even with a straight needle, you can see that drawback or flash right here in this area. You can see it. You can tell if you're in that vein or not. Because this right here, you'll see the blood starting to fill up in this little reservoir right here. So once I see that, if I have the tube already in hand, I would then just go ahead and pierce the top of it to allow the blood to begin to aspirate. And it's whatever technique works best for you, because what works for one person may not work for the other person. You're going to have to find out what works best for you. Right? Just the Vacutainer passive shielding blood collection needle just goes over the different types of needles that you will see while in the field. Some of the different types of needles that you will see while in the field working. Blood collection tubes and additives. Two criteria used to describe vacuum tube size are the external tube diameter and length, maximum amount of specimen to be drawn into the vacuum tube. Please see table 8.1 and 8.2 in the textbook. Right? Each vacuum tube color coordinated according to its additives. Right? You guys think back. What we're about to start talking about now is some of the things that I referenced to in our lab video from last week. Right? Use serum, plasma, or whole blood for various assays. Many coagulation factors involved in blood clotting. Coagulation prevented by addition of different types of anticoagulants. And again, these are the things that you find in the tubes. Like if you go back and watch that video, you'll see how I mentioned about the gel substance, the yellow tubes that we have in the lab. They have a substance in them, a liquid substance in them, and that's why it's important to know the order of draw, what tubes are being used, if the tubes have additives in it, and based on the types of tests that are being ordered. Okay, you definitely don't want to use a tube with a additive in that's going to keep the blood from clotting when the test gives a much better reading when the blood has clotted. Right? Anticoagulants often contain preservatives that can extend the metabolism or lifespan of red blood cells, RBCs, after blood collection. So this is where, starting with this chapter, you're going to start hearing, in addition to, well, it started with chapter 6 when we're doing the medical terminology. Um, a lot of things in the medical field are abbreviated, so I don't want you guys to be thrown off when you hear certain terms in the work field or when your instructor uses them. Okay? Anticoagulants are often referred to as being AC. Red blood cells are often going to be referred to as RBCs. Yellow top tubes and vacuum culture valves contain sodium polyethanol. Right? And it's used for blood culture specimen collections and microbiology. Right? Tubes containing ACD additives used for specifically blood banking. And just as I mentioned, that when we're doing blood cultures are normally warranted if we feel that there's a bacterial infection in the blood. All right, this is when the yellow tops will come into play. Right here, you see the blood culture vial or blood culture bottle I showed you all that in the video as well. In the blood culture, that blood culture kit, it will have two bottles in it. In there, you have your aerobic and your anaerobic bottles. Um, this is, if you look here at this gray top tube here, look at this gel, the clotting factor here in the bottom of this tube. That's what I was referring to. All right. Next, we have the light blue top tubes contain sodium citrates. Many coagulation procedures such as PT and APT are performed and blood collected in light blue top tubes. Mm-hmm. And this, if we're going to check and see, want to make sure that you're not a homophiliac. Make sure that your blood is clotting properly. That's what we will use a blue top for. In addition to the PT and the APT, it's a few different tests. All right. The light blue top tube um, is underfilled. Coagulation results may be inaccurate. Right, and this is what I was saying earlier on when the lecture started. That's why I'm not necessarily a fan of going ahead and piercing the top of the tube, because I know and understand things that can happen. All right. So due to the importance of correct amount of blood, these tubes cannot be can be obtained with field lines. Each tube has a black line that will indicate how far it needs to be filled. Right here is a picture of a blue top tube, and this triangle right here, it indicates where the tube needs to be filled to at least the point of the triangle coming this way. All right. Serum separation tubes, a lot of top, speckle top, and gold top tubes. These tubes contain a polymer barrier at the bottom, in the bottom of the tube. During centrifugation, the polymer barrier forms a barrier separating the serum from fibrin and cells. Okay, and it goes back to uh, the tube I just showed you all next to the blood culture bottle. That gel substance in the bottle. This is what's going to happen when it's placed in the centrifuge. Okay. All right. Here you see it here also. You can see it there. All right. Now, one thing to look out for: please do not get this gold top mixed up with the yellow tube. Please do not do that. Make sure that you're paying attention to what tubes that you grab. A yellow top is indeed going to be yellow. These are different types of gold tops. Be the red on the outside with the gold in the middle, or the top itself would just be gold. Right? Rapid serum tubes, so RST, orange and gray. Orange and gray and yellow vacuum top tubes have the additive thrombin in it. Completes clotting of blood in less than 5 minutes. Used for STAT emergencies, laboratory procedures requiring serum specimens. So here you have just a regular the red top tube. All right, orange top tubes have a thrombin-based clot activator with gel for serum separation. Tube is for stat serum determination in chemistries. Tube inversion should be 5 to 6 to ensure mixture of the clot activator with blood. Blood clotting time is only 5 minutes. Clear top tubes, white top tubes, and red light gray tubes. Tubes with tops of clear white or red light gray plastics are used as a discard tube or a secondary specimen tube. These tubes do not contain additives. That is highly, highly, highly important for you all to remember. The red top tubes, this is the basic red top tube. Like I just showed you a couple slides ago, you see it in your book. In figure 8-7, these tubes are not going to contain any additives. Okay, in about 5 minutes, if left sitting, once you it's immediately going to start to clot. Okay, um, so please be mindful of the tubes that you are using. Pay attention. And some of the common tests for your red top meant to mention before we went on. Again, as I mentioned in our video, um, pregnancy, thyroids, BMP, CMP, lipids testing, all these tests are synonymous to the red top. Okay. Now moving into the green. Green top tubes and plasma separation tubes contain anticoagulants or AC, sodium heparin, ammonium heparin, and lithium heparin, used in various laboratories assays requiring plasma or whole blood. Right? Green top tubes and plasma separation tubes, green top vacuum tubes should not be used for collection of blood smears on microscope slides. Okay, and that's because the additive that's in there, that sodium lithium heparin, um, it could be with a separator or without a separator. And when you're looking at And when you're doing blood smears, you need to see the blood in its entirety, made up of all its components. If it has a separator in there, it's going to start breaking everything down. The red blood cells are going to start separating from the white. You have serum, plasma, and that's what you don't need. Right? So that's why you can't use the green tops for the blood smears. All right. Common tests associated with this are plasma testing, or anemia. Okay, it's some tests that are commonly associated with that, with the green tops. All right, just insert figure 8.8, vacuum and plasma green top tubes and lithium helping gel, courtesy of Garner Blue. Yeah, I think that's just an instruction. I don't believe the company just forgot to add the picture of the tube here. All right. BD Vacutainer barcode tubes uses mechanical separator and reduces centrifugation time from 10 to 3 minutes and reduces cellular contamination by 50 to 65% compared to other current plasma gel tubes. Mechanical separators used to absorb the hydrophobic drugs and therapeutic drug testing. Right? So whenever it is doing, if you have to get blood drawn doing therapeutic drug testing, which is something that we talked about in EKG, and your blood has to be drawn, it'll be done with a green top tube. Purple or lavender top tubes contains EDTA, right? Hematological procedures, molecular diagnostic testing, immunology, hemoglobin A1C, blood banking procedures. Right, so say if you worked at anything dealing with whole blood, where we're testing, where the blood needs to be tested as close to its entirety as it possibly can, you'll see the purple top tube being used. So it's something that you will see if you work at two places right off the back. You should see them at life shares, and you will see them in the plasma labs. Right? Next up, we have the pink top tubes. These also contain EDTA, used for blood blank collection and or viral collection. Right? Again, if wherever you're working at doesn't use the purple top, may use the pink top. Just depends on that company. Right? You have gray top tubes used to contain potassium oxalate and sodium fluoride. Um, you have your Na2 EDTA, which is sodium. If you're familiar with the periodic table. Sodium, and two molecules of sodium and EDTA and sodium fluoride, or only sodium fluoride. Is used for glycolytic inhibition tests, anti-glycolytic agent, and glycolytic inhibitors are the terms for the tubes additives because it prevents glucose breakdown. Next up, we have our royal blue top and tan top tubes. Royal blue top tubes used to collect samples for nutritional studies and toxicology. Royal blue top tubes are trace element tubes. Tan top tubes used for lead testing and contains EDTA. A couple years ago, when lead was like a big thing, kids had been peeling paint off the walls, eating the paint chips, found a whole bunch of toys had lead in them. These things that the kids play with, put in their mouths. So in the event that it was believed, they were led to believe that their children may have had lead poisoning when they went to the doctor and had their blood work done. They definitely used the royal blue tops just to check and make sure that that wasn't the case. Another thing that the blue tops are used for, we just mentioned toxicology. Anything dealing with drugs, they want to see how what effect the drugs are having on a person's body. Then they'll do, and if it calls for blood work to be done, they'll be using a blue top, royal blue top, to run that test. All right, black top tubes. Black top tubes with buffered sodium citrate for blood collection to determine erythrocyte sedimentation rate is available for certain manufacturers. All right. Molecule diagnostic tubes. Special sterile vacuum tubes for molecular diagnostic studies available containing different additives, sodium citrate, sodium heparin, EDTA, as required for different testing procedures. Manufacturers have different color types. All right. This is will be a silver top. And this is what they would the tube you would see for the molecular diagnostics cultures. They have a plasma separator at the bottom of it. Tube organizer. Timo, tube management organizer is a test tube holder that assists with managing test tubes during blood sample collection. Okay, and that's what that person has there in their hands. Right, it's gonna keep the tubes together. And you pull them as you need them, or place them in there. Just depends on where you are, how they want it done. Right? Used for patients whose veins are too fragile for blood collection. With vacuum safety butterfly needle blood collection sets perform as the preferred method. Syringes are hazardous and pose an increased risk of accidental needle sticks. Right? And that's because they don't have, like, syringes aren't do not come equipped with um, the tube holder or tube cover for which you to discard the needle in after use. So typically with that, you have to just put it straight in the sharp. You have to put it straight in the sharps container. Uh, for a while, long time ago, they would attempt to put the recap the needle, but we know we never want to do that for for the very exact reason that we may be prone to a needle stick. Sometimes used for collecting blood for central venous catheters, CVC lines, consistent with consists of a needle, safety cover, hub, barrel, and a plunger. Right? Those are all the parts of a safety syringe. All right, and you can see them there. You guys want to make sure that you familiarize yourself with this, with those parts. Syringe needles should be shielded after blood collection removed and discarded in sharps containers, sharps disposable containers. BD blood transfer device activated, attached to syringe, and a vacuum tube is inserted into the transfer device. The blood is transferred from syringe to tube using the tube's vacuum system. All right, this yellow part right here, this is the safety device. So after the needle is removed from the patient's arm, you will grab the wings and holding it at the base, you will pull the needle down into this yellow reservoir right here, um, protecting you and others from being prone to a needle stick. Right, this is a syringe blood transfer unit. Um, See, after the needle is been removed, you will place the syringe, uh, place a hub inside the syringe. They screw in together. This part, this thing in here, this is a needle. It has a rubber covering over it. So once you put the tube in, that needle again pierces the top of the tube. So and then you will gently press on the plunger to transfer the blood from the syringe into the tube. Gauge and length of needle. Gauge number indicates the diameter of the needle. Smaller the gauge number, the larger the needle diameter and higher the flow rate. Larger 18 gauge needles used for collecting donor units of blood. Right? Uh, and so this is very, very important. Also, don't think because if someone says you need a small needle, or someone says, "Hey, get me a small needle," you wouldn't want to go and grab a like 17 gauge needle because it's 17 is lower than 25. It's the exact opposite. So please be mindful of that. Please, 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 please be mindful of that. All right. This is what I just talked about. Smaller 21 and 22 gauge needles used for collecting specimens for laboratory assays. BD Eclipse safety shielding blood needles is attached to a holder. All right, gel coat venipuncture needle pro safety device is a protective holder. Vantage point blood collection tube holder automatically retracts the needle directly from the patient upon activation. And this might not be a thing where you go. Again, just depends on the organization, the facility, what they're budgeted for, what's been working best for them over the years. So that's why it's best to know how to work with everything. We are limited to what we can work with. But I do believe that some of our needles do um, have that safety device on. Like if you look on the well, I don't even want to um, give you an example of something because I don't want you uh, thinking the wrong thing. Oh wait, I take that back. I want to do butterfly. So if you look back on the butterfly at figure 1813, there is a yellow, hold on, right. Backward quick shield safety tube holder devices is used by pressing the protective cover over the needle with the aid of a stable surface and then disposing of the needle and the holder into a sharp disposal container. Um, so if you look here at figure 815, this pink part here, this is the protective covering that you will close on the needle after it is done being used. Make sure that you dispose, cover the needle with this for prior to placing it in the sharps container. Again, just to minimize the needle stick possibility. Right here in Figure 16, you see the person activating the needle shield. I would not recommend using my hands. Um, again, because now you're putting yourself at risk for being um, susceptible to a needle stick. Just tap it on the side of the table to close it. All right here, this is a Vantage Point blood collection tube holder. Uh, once the needle has been, once the tube has been pulled out of the container, the needle automatically retracts with inside the hub itself, again to minimize the needle sticks. Right here, uh, again you see the quick shield completely, the quick shield on the side of the needle. One that those that are capped and those that and one that is not capped. Right, and same thing applies prior to finishing the use of the needle. Simply gently tap this part on the side of the table, ensuring that it covers the needle. You will hear a click indicating that it is securely covering the needle. All right, the Esmonivut blood collection system, enclosed multiple sampling blood collection system, collects blood using either aspiration or vacuum principle of collection. Each needle has integral holder that does not require assembly before the use and cannot be disassembled. Right. See, we see that here. This is right here. This is a combination of like the syringe needle and tube is all one device. Interesting. Never seen that before. It's new to me. All right. Check tip of each needle for damage. Multiple sample needles used with venipuncture collection tubes and the holder to allow for multiple tube changes without blood leakage within the plastic holder. And typical what this is saying is that prior to removing the cap off the, or after you remove the needle, the cap from the needle, you want to make sure that you inspect it before you stick it in someone's arm. You want to make sure that it's not bent. It's just not broken or anything of that nature. Butterfly needles blood collection sets, also referred to as the blood collection set or safety winged infusion, most commonly used for intravenous devices. Most commonly used intravenous device. Most commonly butterfly needle sizes are 21 and 23 gauge and often range from half to three-quarters of an inch long. These needles each have a shield that automatically covers the contaminated needle point upon withdrawal from patient's vein. Right? This is kind of what we talked about already. When I went back and I showed you guys that picture with the yellow retractor. This one is a mechanical one where you pull out. These have like little clamps on the side, and once you press, there'll be a clamp on like each side, and once you push the buttons, the needle will itself will retract down into the holder. Yeah, the safety blood collation set. You typically see this set associated with blood cultures. It is not synonymous to them. It can be used for other things, but that's when you will see it the most. If you're required to use the aerobic or anaerobic bottles for blood culture collection. All right. Um, Safety wing infusion blood collection set. So exactly what it looks like. You see the person here. They have finished the needle. They are activating the safety device. You see how that works. It's another different type of safety devices like how we just talked about in figure 821. The clamps on the side will be pushed to retract the needle uh, down inside the tubing itself to reduce the risk of exposure and needle sticks. The BD Back Container Ultra Touch Push Button Blood Collection set is a wing set combination combining two technologies trademarked as pintle point comfort and right gauge. Vacuum Safety Blood Collection Set is a wing needle device with a safety shield. Sir Shield Winged Infusion Blood Collection Set is a safety engineered butterfly device for blood collection for IV insertion, needle, and other sharps disposal. Must be discarded in a rigid leak-proof plastic container. Each unit is usually orange or red, disposable as biohazardous waste. Right, you want to make sure that you put them in the bio or sharps container. Okay, very very important. Here's what the sharps container looks like. You guys see them around the lab, or you will see them around the lab. All right. I also show the sharps container in the lab video the other day. Tourniquets. All right, so you have different types of tourniquets. You have the pliable strap, Velcro strap, blood pressure cuff. Uh, then you have your proper racket, which is like a seatbelt design. All right. Key to successful venipuncture lies in the tourniquet. Provides a barrier to slow down venous flow. Uh, Non-latex disposable tourniquets are now available. People have different skin types, different things aggravate their skins. I myself have very, very, very sensitive skin. So does my daughter. Um, So I have to make sure that I have a non-latex used tourniquet. Definitely allergic to latex. If I'm exposed to it too long, then like my skin will start to get irritated. I can work around it, work with it, but too much exposure to it, and my skin definitely gets irritated, start to swell and things of that nature. These are things that you want to be mindful of. This is why you want to read your patient's chart, as we discussed earlier on in the text. Um, why it's important to read the patient's chart and know what it is that you're getting yourself into, because the patient, no matter if it's your first day on the job or if you've been there for 15 years, that patient doesn't know you. They are automatically going to perceive you as being the expert. They're going to need you to know. They expect you to know what you're doing, because their life, in some shape, way, form, or fashion, is in your hands. So make sure that you read the chart, make yourself familiar with the the patient background. Right? If the tourniquets used in healthcare facilities are not disposable, they can be wiped frequently with 70% isopropyl alcohol and disinfected with chlorine bleach dilution of with a ratio of 1 cap of bleach to 10 caps of water if contaminated with blood or other body fluids. Right? Again, uh, you definitely want to make sure that you decontaminate surfaces. Everything that you do use, make sure that you decontaminate them just to prevent the spread. Again, I've said it quite a few times. Cleanliness is everyone's responsibility. It's not, oh well, that's not my job. Is that in the third? That was here when I got there. It doesn't matter. Let's just get it cleaned up. All right, just get it cleaned up. Get out the way. Save yourself the trouble. Put in a little extra work on the front end, or put a little extra work on the back end, and the rest will take care of itself. All right. Here's what some latex-free um, tourniquets look like. All right. Venoscope and vein finder. Method to detect a vein for blood collection provides a non-invasive procedure to visualize veins. Evasive means inside the body. Invasive means outside the body. All right, and this is what the Venoscope looks like. You can definitely see this device in action in all its glory within the textbook itself. So you just make sure that you flip through there. It'll be under the Venoscope and vein finder section, which appears right after comes right after tourniquets. And this is the device itself. It's what the it's another type of device. It's a much smaller one. So you plug it in like the aux cord. It's your lights right here. AccuVein viewing system, non-invasive, portable, handheld, lightweight tool that provides a quick location of the veins. All right, see how it works there. That ultraviolet, that infrared light, we pass over the skin and the outlines where the veins can be found. No, we do not have these in our lab. No, we can't get them because they cost a lot of money. You just have to make sure that you practice, get familiar with knowing the veins, how the veins lay in each arm. Um, the layout is fairly the same in everyone's arm. Either the veins are going to lie on the top of the arm, or they're going to lay to the side, just like they do here in this picture here. See, the veins run to the side, but they still follow the same passageways. And here, it's another patient with veins on the inside of the arm. It's kind of too far down to be sticking someone. Uh, so you definitely want to keep the sticking up here in this area if at all possible. Uh, and that's for the top and for the side. Definitely don't want to definitely want to avoid sticking someone in this area at all costs. Like this is extremely risky. Um, so try to avoid that at all costs if you can. Uh, Gloves for blood collection. Use gloves during collection of blood from patients. Do not use gloves with talcum powder. Change gloves between patient blood collection. Do not wash, disinfect, or reuse gloves. All right. This is um this is going to be at the discretion of the place that you are employed for. I've worked at places where they have been so hung up on meeting budget where they would suggest that we wouldn't change gloves in between patients just to cut down on supplies because gloves are very, very expensive. As we're seeing that now in the height of this whole pandemic. Medical supplies are not cheap. Okay, you could go to Lowe's or Home Depot and go in the paint section and get the N95 mask. You probably get like two for $10, but to get a box of them would be somewhere up to like $200, and you're probably going to get like 30 or 40 in that case, right? So think on average, a hospital staff has about 150 people. 150 people, I'm only getting 30 masks in a box. That's a lot of money that I'm kicking out. Again, so this is going to be at the discretion of the place that you work. Um, so just be mindful of that. It is not right in any shape, way, form, or fashion, but you have to make sure that you are in compliance with the rules. If the place tells you that, hey, let's minimize the amount of times that we change gloves. Don't change your gloves unless they get really, really dirty. If the patient asks you to change your gloves, respect that patient's wishes and change the gloves. Okay, there was not no back and forth. We're not gonna get into the analytics with them about what the business is doing, how the company is being run. You just change the gloves. All right, simple as that. Not again, we're not gonna do the back and forth with the patients. Just change the gloves. All right. Uh, Definitely don't want to use those gloves with talcum. Yeah, you definitely don't want to use those gloves with talcum powder in it. Talcum powder um, is a something used to keep the skin from being irritated. It's used in the aid of helping things clot. Uh, but research has come out um, over the years and showing that there is a direct link between talcum powder and cancers like mesothelioma and things of that nature. So definitely want to be mindful of that. You would know if your gloves have talcum powder on it because when you go to put your gloves on, you can feel that powdery that powdery like substance like on your fingers. Like your hands will be like really smooth. After that, and you can see the white residue left behind the powder on your gloves. All right. This please do not wash and disinfect your gloves. I've been seeing like a lot of people doing that now in the height of this pandemic. In addition to just throwing them on the ground, this is why this thing is never going to. It's never going to. It could have been gone. All right. There's a lot of things that everyone could have done to keep it from getting to this point, but doing things like this, washing gloves, um, let's just not do that. That's just not it's not smart moves. It's not good health practices. So yeah, that's not. All right. Here. So when you see someone medical healthcare worker donning gloves, all right, antiseptic, sterile gauze, pads, and bandages. These items needed for blood collection by either venipuncture or microcollection. 70% isopropyl alcohol preparation, iodine, swab sticks, and or uh, chloroxidine for blood cultures, essential for blood collection. All right, micro collection equipment. Usually, skin puncture blood collecting techniques are used on infants because venipuncture is excessively hazardous. For infants, CLSI recommends a penetration depth of less than 2 millimeters on heel stick to avoid penetrating the bone. Okay, so if you ever find yourself in a place where you're working in the hospital and you're in the NICU, you have to go in and draw blood on those babies in the middle of the night to do testing, whatever the case may be. Definitely want to make sure that you use the appropriate apparatuses to make sure that you do not go more than 2 millimeters deep on that heel stick. The risk of puncturing their bone because that could lead to a medical condition within itself. All right, lancets and tubes, BD, quick heal lancet, BD microtainer, contact activator lancet, Trumo copperject lancet, Tenderlet automated skin incision device. So all different types of lancets and tubes that you will see in the field. All right. Continuing on, you have your starting safety lancet, your G Bio 1 lancet, and your NATO's medical Neatnik lancets. All right. Here, the quick heal lancet. See it being placed on the infant's foot there to make sure to draw blood. These needles, the needles inside here are designed specifically for heel sticks and capillaries. Um, they have a certain size and a certain length to ensure that when the needle is deployed, that it does not go beyond the depth in which it needs to. So that's why you see how this person has a firm grip on the infant's heel, and they are not pressing the the lancet itself into the skin. It's kind of just there resting on the skin. So once they push the button here, they won't go too deep into the heel. All right, here are some more activated lancets. All of them the same way, say designed the same way. A certain needle length, a certain needle depth, so that they don't go too far. All right. Here's another. Here's a Neatnik lancet. Some more. There's more than one that you will see in the NICU because typically when your first blood work is drawn, babies tend to be so small. This needle is more safer to use. All right, micro containers, plastic micro hematocrit capillary tubes, disposable narrow bone pipettes narrow bore pipettes used for packed red cell volumes and microcentrifugation. Have colored bands. Red band indicates heparin contaminated tubes. Heparin coated tubes. Blue band indicates a no anticoagulant. Right. So these micro container tubes are just like their regular vacuum tubes. Okay. Some of them have additives and some don't. So you want to make sure that you make yourself familiar with what tubes do, which tubes don't, and what the tubes that do, what additives they have inside them. Right. Plastic microcollection containers for general laboratory collection, usually color coordinated uh, according to established protocol for blood collection vacuum tube tops. Right, micro containers, BD micro container tubes, safety field, capillary blood collection system, micro microvet microvets, capillary blood collection system. All right, Cabojet capillary blood collection tubes, the G1 uh, mini collect capillary blood collection tubes, um, RNA medical brand safe wrap combo blood collection tubes. Right, and here's what they will look like. At one point in time, we had some of these in the lab. Not sure if you guys still have them, but this is what they look like. You can see like these have additives in them. Well, maybe not so much as the last one. I think I went too big on that circle. So it's just from these three have additives in them. All right. And there, here you see the capillary tube uh, inside the holder. So once the incision is made using a lancet, the blood can be filtered down into the tube through the capillary tube itself. And you can see that some of them have additives in them also. These two. All right, and it's just more of the different types of tubes and what they look like. Same thing here. The different types of tubes, what they look like. The safe wrap um, combo blood collection system. See, the blood has been collected into the capillary and is being placed into the safe wrap. Right. Uh, the BMP leukocheck uh, microdilation system, collation and dilution unit for blood samples, increasing speed and simplicity of leukocyte and platelet counting, disposable self-filling diluting pipette, straight thin walled uniform bore plastic capillary tube fitted into a plastic holder, includes plastic reservoir containing pre-measured volume of buffered um, ammonium oxalate solution. Um, Different options, recliner type chairs. For so now we're talking about to get into the blood drawing chairs. So you have a couple different options. You have the recliner type chairs, chairs with adjustable armrests, leg extensions, neck pillows or support, scale mounts, storage cabinets, um, hydraulic lifts, and foot covers. Right, maximum safety and comfort for patient, easily accessible to either arm. Should have armrests for patients' use during blood collection. When you walk into the lab, that green chair there immediately to the right, as soon as you walk in, is a reclining chair. Has the when you recline back, your legs go up. Has great support for your neck, um, and it can be used for either side. All right. Should have armrests that lock in place so patient cannot fall from chair if he or she becomes faint. should have armrests that adjust in an up and down position to achieve the best venipuncture position for each patient. Taking on blood collecting rounds made of plastic, preferably latex free, that can be sterilized, includes all necessary collection equipment. Talking about specimen collection trays here. For home health care providers, carried in an enclosed container with biohazard symbols on the outside, lockable to protect the contents from tampering or accidental contamination, has a tight seal to reduce the risk of infection from blood-borne pathogens due to spill or accidents. This is what the safety collection tray look like. Some of you have have setups like this that you all did with Miss Green. Um, so you should be. So I'm pretty sure some of you all are familiar with that. All right. This is the cover that goes over them. Again, this is to ensure that there's no contamination. Make sure no one is tampering with it. All right. And that is chapter 8.